Recent studies have shown that only 8% of U.S. adults aged 35 or older had received all of the billable, high-priority, appropriate clinical preventive services recommended for them. Healthcare providers are struggling to keep up with all of the latest requirements, and outsourcing these functions means losing control of the clinical portion of patient care and paying a high price tag. The WellPrep platform by MassCare was created for this purpose. WellPrep is a cloud-based technology combined with clinical staff that will connect with 95% of your eligible patients through smartphone secure links and patient outreach, identify required screenings, and generate a provider summary which will be uploaded into your EHR for access during your next scheduled patient visit. The WellPrep platform is designed to support adults in understanding their health risks. The software promotes health behavior changes with the goal of reducing risk and living a healthier life. Survey questions are completed in a computerized form, and risk computation software libraries produce an individual risk report. There are 4 component parts that operationally define a WellPrep assessment: an epidemiological, biomedical, and behavioral database, the participants database, most generally derived from a questionnaire made up of items that directly or indirectly assess a known precursor for a health outcome, a model, statistical or otherwise, for weighing risk indicators, generally referred to as the algorithm. These can be both quantitative or qualitative, and the output or feedback component, which is the participant's WellPrep risk assessment report. This component may also contain a series of recommendations regarding how risk can be reduced. A provider summary will be created for each patient encounter and will be able to identify billable CPT codes, provide documentation to support billable CPT codes, provide medication updates, recent patient visits, labs due, immunizations due, and preventive schedule eligibility, create a custom patient care plan, and identify program eligibility status for chronic care management, behavioral health integration, and remote patient monitoring. There's a simple 3-step process to get started. First, a simple service agreement will be executed. Next, your clinic will meet with MassCare's launch team who will walk you through the process. Then, your clinic may immediately begin generating up to $400 per patient in addition to revenue generated from care management services identified through the platform. Once a WellPrep patient care plan is produced, MassCare offers the perfect complement with the WellMass program. WellMass is a workflow management technology for chronic care management, behavioral health integration, and remote patient monitoring, integrating proven processes, procedures, and technology needed for a successful, profitable program. Best of all, clinics have the option of maintaining complete control of the process by using their own employee, or may optionally outsource to MassCare's clinical call center employees. Integrating WellMass into your practice is fast and easy. First, MassCare will train a staff member, which will include live calls between patients and the MassCare clinical team. Next, through a combination of your EHR and MassCare's workflow management software, your clinic will be able to identify and start enrolling patients. Once enrolled, you'll be able to generate care plans for each patient, which can be uploaded into your EHR and emailed to the patient. After that, your care coordinator will complete monthly structured patient tasks and questioning per disease state. The technology will aggregate time, documentation, and billing codes associated with these efforts, and will generate a monthly billing summary. Successful practices can generate over $30,000 per year for every 50 patients enrolled.